Kaiser Permanente workers gathered outside of the Santa Rosa campus on Wednesday, October 4th, to participate in the largest healthcare strike in U.S. history. 75,000 total employees have gone on strike throughout the country after failing to reach a contract agreement. Severe understaffing, annual bonuses not being given out, and wages not being high enough to keep up with inflation and the rise in the cost of living are some of the reasons as to what prompted this historic strike. Many of the employees stated that understaffing at Kaiser has now caused one worker to do the job of 3, burning them out, which is leading to suboptimal patient care. The strike began at 6 a.m. on Wednesday on Bicentennial Way. The last thing I wanted to do was listen to people screaming in megaphones at 6 in the morning, so I waited till noon, grabbed my camera, and I went out to document what was going on. Many strikers were hesitant to talk to me, like this nurse who asked for her face to not be shown on camera.
Okay, this is the heart of Kaiser, right here. And when patients are cared for in a short-staffed situation, then they don't get timely blood draws, they don't get timely x-rays, they don't get timely transport. So this is the heart of Kaiser. Okay.
Many irritated employees mentioned the unfair distribution of pay, most notably the $16 million Kaiser CEO received in 2022. 49 other Kaiser executives each earned over $1 million that same year. The strike spanned across 7 states, including Washington, Colorado, and Oregon. In Sonoma County, about 1,800 workers are represented by the Service Employees International Union United Healthcare Workers West. Try and say that 5 times fast. At least 200 Kaiser workers in Napa County are also involved. In California alone, the union represents about 59,000 Kaiser workers. Understaffing seemed to be the most common issue among strikers. Starlene, a licensed vocational nurse, was one of the main speakers on the picket line. Good thing I forgot to plug in the lavalier mic.
Hi, my name's Star. I've been an LVN at Kaiser Permanente for 25 years. I'm out here as a frontline healthcare worker. We're encouraging Kaiser executives to help us with our staffing crisis. That's why we're striking, due to the staffing crisis.
What do you think needs to be changed?
Kaiser needs to sit at the Kaiser executives need to sit at the bargaining table and bargain with us. They've had 4 months and they have not done any good faith bargaining.
Do you have hope that things will be changed after the strike?
I'm hoping that a miracle happens after these 3 days, absolutely.
One common theme that I found among a large portion of the Kaiser employees was a lot of them didn't actually know why they were striking. A pharmacy employee told me he was actually pretty happy with Kaiser and he made good money for not having a college degree. When I asked him why he was out here then, he told me he didn't want to be the only one in his department that wasn't striking. A union representative passed out these pieces of paper to everyone participating. On one side, it described why the strike was happening, and the other side was a list of chants to shout out loud with everyone else. I continued my trek down the sidewalk to see who else was willing to talk to me.
Fiona Rogerson, X-ray tech, Kaiser Permanente, 35 years.
What are you doing out here?
What am I doing out here? I'm supporting my coworkers, my union, and my patients.
And what do you hope to change after this strike is over?
I hope that we have better health care, we have better staffing, that we're able to provide better patient care in general.
During all of this, Kaiser put out a statement stating that the strike does not involve its nurses or physicians and that Kaiser hospitals and the emergency departments would remain open. Hospital pharmacies for inpatient care and critical infusion services also remained in operation. Many employees who didn't want to speak on camera suggested that I walk across the street to talk to union reps, but they didn't want to speak on camera either. So this was me attempting to film a point of view angle of what walking through the picket line looked like. It's not my best work. With temperatures reaching 95 degrees and the majority of strikers refusing to speak on camera, I decided to pack my stuff and head back to my car. Right as I was about to leave, a group of employees flagged me down and asked to be interviewed. This is what I got.
What's your name?
Andrea.
And what's your position here at Kaiser?
Senior staff assistant.
Okay, why are you striking?
Safer work conditions, patient care, better benefits, and...
Better pay, more help. We need help.
Stop! Wait, no, delete that.
No, we need...
My name is Amanda Wood, and I am the lead stenographer.
Okay, what's going on out here today?
We're striking due to unfair labor practices. We're hoping to get a raise that comes close to what the increase in inflation and cost of living is. We didn't get our bonuses this year, even though management and nurses did. They said they couldn't afford it, and we're trying to get adequate staffing because we're understaffed and overworked.
How has the understaffing affected you personally?
Sonographers have the highest injury rate of all employees in healthcare. We are forced to do extra patients and rush through our exams, and in turn, a lot of us are injured, working in pain, and fighting to keep going to work every day. I hope that we come to an agreement on our wages and our bonuses and on our staffing, and quit using travelers and outsourcing a lot of our jobs, and hire fair people and hard workers, and we can all work together and take care of patients.
Beautiful.
2 weeks after this footage was shot, Kaiser and the unions involved in the strike reached an agreement which established new minimum wages over 3 years for union employees, which Kaiser said will reach $25 an hour in California and $23 an hour in other states. It also provides across-the-board wage increases totaling 21% over 4 years, according to a statement from Kaiser. The deal also requires Kaiser to invest in job training programs and use referral bonuses, mass job fairs, and other workforce development efforts to ensure an adequate supply of new employees for the future. I guess this strike was deemed a success.